we spoke about an introduction to what we call as a phrase called brain function tests in the previous video. If you have not watched that video, I encourage you to first watch that video before you come and watch this, because it's contextualized there of what is this brain function all about. So we at PRS Neurosciences are trying to actually crack this code in a simplified way so that we can mass roll this across the entire communities across the world, a concept we call mass customization. Hi everybody, my name is Dr. Sharan Srinivasan and I'm a functional neurosurgeon from the Silicon Valley of India, Bengaluru, India. And like I said in the previous video, I come from the original IT industry, which is the central nervous system headed by the brain. So now, when I started thinking about functional neuroscience, brain function, it was very simple. Everybody's question was, what's going to happen? I'll tell you 3 stories of patients of mine that got me thinking on this work when I was a student in neurosurgery. The first was an IT professional's father. He had a right-sided brain hemorrhage or a stroke. He had a left-side, body weakness. Plus, he was semi-conscious. The clot was not big enough to operate. We were managing with medicines, and we always are told by our seniors that if we don't operate the clot dissolves in 8 to 12 weeks. So we were parroting that to the family. And the patient was initially in the ICU, came to the ward, and eventually I was the ward in charge doctor. So when patients are there for long periods of time, many weeks, you get friendly with the patient attenders. So I became friends with this guy, and one day this guy came and asked me, Sir, Dr. Sharan, can we do a scan to see what's happened to the blood clot? It had been a while since we had done it. I asked my chief, he said, go ahead. I did the scan, and to my good fortune, 80-90% clot had dissolved. And as a small marine neurosurgeon is what we call, I felt so proud, that, as of my treatment, dissolved the clot. But whatever, you feel that I guess all of you have been very early in your careers, you believe that you change the world, you change the company and things like that. I was in one of those places. And I went and triumphantly told him, the clot has disappeared 80%. And even before I could smile completely, he asked me back a question. Why is my father not talking? Why is he not walking? Why is he not waking up? And I said, what is this guy talking? And that moment, what hit me? I realized that physical healing is not equivalent to functional outcome. Physical healing is not equivalent to functional outcome. I was talking about blood clot dissolving in the brain. He is talking about his father functioning. And why? Because this guy had left his job and is sitting in the hospital. So he was thinking, he interpreted our dialogue of 8 to 12 weeks the clot will dissolve, that in 8 to 12 weeks the clot will dissolve, my father will wake up, get up, sit, stand, walk, eat, I'll leave him at home and get back to work. Fair assumption? Absolutely. And we were guilty of not communicating to them functional issues. First story, and he was so upset with us with that. First story. Second story is one alcoholic guy crashed in the night, was brought unconscious and unknown to the hospital. This is the pre-mobile phone era, picked up by the police. We had this mandate in our hospital that somebody comes in critical, unconscious, unknown, it doesn't matter. If do everything that needs to be done, even surgery, and he had a clot in the brain, needed to be operated to save his life. I signed the consent form myself and took him to OT, operated him. Eventually, over a couple of weeks in ICU and ward, he started getting better, and eventually one fine day, he was able to get discharged. He was awake, walking with support, but his memory and behavior was very bad. One day, his wife came to me in my OPD and said, why did you save my husband's life? I said, what happened? Till then I was feeling, like this deadly neurosurgeon who has saved somebody's life. And she said, I said, why, Mom, what happened? She said, sir, if he had died, I would have got a job and taken care of my children. This guy is not able to manage himself, forget about going out and earning money. And because he can't manage himself, I'm not able to leave him at home and go out to work. And because there is no income for the family, I've had to pull both my daughters out of school because I don't have money to pay the fees. And I told myself, what have I done? I have given the family a curse, not a joy. I said, this is the problem. I didn't like it. Thirdly, there was a guy, young, newly married, 6 months, wife is 3 months pregnant, Businessman had a clot in the left side of the brain that controls his speech areas, came in unconscious because of a head injury, preoperative, before operation scan clot, most scan after CT scan after surgery no clot, which means operation successful. This is what I thought. He eventually woke up from unconsciousness, started walking around. He went home, he came back for a follow-up. When I saw him, this man looked tip and smartly dressed, but he had no speech. He would not even recognize to his own name. There are two areas of the brain for speech. One is called the understanding area, second is speaking area. Both the areas were affected. He would not respond to his own name. He didn't recognize himself, his wife or his child. I saw him and told myself, what have you done? We have given this family an animal. Because what differentiates animals from human beings is communication or language, and thus he didn't have. That's when I realized just operating, removing blood clots and allowing the wounds to heal and saving people's lives was not enough in neurosurgery. I thought I needed to look much beyond that, because the expectation by the family minimum is they should be able to manage themselves, so the caregiver burden becomes less. Caregivers are stuck, they become nurses. They have to clean the motion of the patient, they should clean up the diapers, give him a bath, feed him. They are nurses, they have lost their identity, they have lost their lives. So that is when we realized that we have to start with this brain function test to map it and give a plan. The next question I asked myself is, where is the current functioning of my patient? The current functioning of my patient was not defined in the medicine at that time. So imagine your child is going to 3rd standard, the teacher is giving either 2nd standard syllabus or 5th standard syllabus. Will you keep quiet? Of course not. You are going to go and ask the teacher, what the hell is going on? My child is in 3rd standard, you are doing this. How can you ask so confidently? Because you know where your child is, you know what the syllabus of that class is, and you know what the syllabus of the other 2 sections is, because of which you can ask a clear question. Similarly, if a stroke patient comes to me, I don't know whether my patient is 3rd standard, 2nd standard or 5th standard. Problem. So if he is in 3rd standard and the therapist is giving a 2nd standard therapy or 5th standard therapy, problem. So first of all, we should understand that. We should understand where my patient is, and for each standard what therapy has to be given. Next question, how do I know my child moved from 3rd standard to 4th standard? There is something called exams, or we call them evaluations. So based on that, we know whether the child is progressing, similarly whether my patient is progressing. So I was thinking, how do I crack this code? And I simply understood the worst case of my patient is coma or unconsciousness. The best case is the patient is back in the community that he is in, going back to his life. So it's a coma, a journey to community. And that became acromanized into a concept called C2C. Coma to community in brain injury rehabilitation patients. It doesn't matter whether it's a head injury, stroke, brain infection, HI, doesn't matter. Is he in a coma? Can he get back to his life? A similar concept of C2C for the spinal cord or neuromuscular problems I call as cot to community, because spinal cord problems usually have consciousness, so there is no coma here. From the cot, bedridden patient to the community. This is a concept called C2C. I love the idea, and because I gave this example of 1st standard, 3rd standard, all of those things, I said let me use the same example. I said from 1st standard to 10th standard, 10 levels are there, let me make 10 levels of C2C. See, we came up with 10 levels of C2C as a logic that I use with my experience. We have 10 levels of C2C, which is C2C 1ABC, 2ABC, 3ABC and 4. 1A being the worst and 4 being normal like me or people like you and me today. Doesn't matter whether it's brain or spine. C2C BIR is called brain injury rehab, and C2C SCIR is called spinal cord injury rehab. Now, this is a great idea. Do you think so? I also thought so, but how to measure it? What does it mean? So then I came up with a test called the SAFER test, self-evaluation of functional abilities in neuro patients, which is part of our first patent of neurologics. So this is the test which is available online. It's currently in English. We're hoping to convert this to other languages in due course of time, and this has 700 plus questions across 18 different sections where you just have to say yes, no as an answer, and it's pre-coded to this one of the C2C levels by me. And based on that, I get the report on my Teams channel. How cool is that? And you know what is the domain name where this test is available now? It is available on a domain name called rebootingthebrain.com. All of you have rebooted your computers, you have rebooted your smart devices. It's time to reboot this fellow. If it's not working, it's called rebootingthebrain.com. It's also going to be available on brainfunctiontest.com in the future. Try rebootingthebrain.com. Anybody in your family has got a stroke, head injuries, spinal cord problems, Parkinson's, not functioning very well, please ask them to visit this website, register, get in there, put in their problems. We will assess, we will get back to you and tell you what's going on. So don't forget, there's a number below. If you need any help to communicate to them, they will assist you online to do the SAFER test. Remember, SAFER is the starting point to know where is your patient today from brain function perspective, and where can he get into the future if we do neuro rehabilitation or function neuroscience treatments well. That's all from me in this video. Thank you very much.